Good morning to everyone, good afternoon, good evening, depending on where you are. Thank you so much for joining us today. A warm welcome to our 2021 webinar series for utilities, which is co-hosted by the Global Water Operators Partnerships Alliance at UN Habitat, GWOPA, and GIZ on behalf of the German Development Ministry, or BMZ. My name is Hannah Swartzenjuber. I'm with the GIZ Sector Program Water Policy Innovations for Resilience, and I have the pleasure of opening today's webinar. So before we dive in, let me show you some basic features of our platform Interactio, which might be new to some folks here who are joining us for the first time. Perhaps most importantly, you can choose a preferred language channel at the top of your screen. So simply click the button Audio Channel Selector, and our interpreters, Elena and Laurent, will talk you through the webinar in the language of your choice. So thank you very much to both of them. If you would like to speak, please let our moderators know by pressing the raise hand button, which is at the bottom left of your screen. And when you are ready to speak, press the large microphone button at the bottom. And once the light turns red, that means that you can go ahead and speak. So red, go ahead. If you have questions for our speakers, which we hope you do, please write them in the chat, and the button is located on your top right. We would also like to remind you that this session is being recorded. Your participation automatically means that you grant recording permission. If you do not wish to be recorded, kindly leave the session at this time and refer to the recording afterwards, which will be shared with everybody. So we are very excited to talk to you today about wastewater-based epidemiology. And you must forgive our silly title, Poop Never Lies, but perhaps that's what's drawn you here today. In the next 90 or so minutes, you will find out just why this title is so appropriate. And I mentioned earlier that this webinar is the third in our 2021 webinar series, co-hosted by GIZ and GWOPA. And in fact, we talked about wastewater monitoring in the third session of last year's webinar series as well. So that session was titled COVID and Wastewater Mind the Poop. So another silly title. But it worked. It was a space where lots of utilities came together to discuss how monitoring wastewater for SARS-CoV-2 was useful in keeping track of the pandemic and for early warning purposes. We agreed that more research was needed in order to accurately determine the quantity of cases of COVID-19 that corresponded to a certain viral load in the wastewater. We also concluded that wastewater monitoring in areas that rely on non-sewered on-site sanitation systems should be further explored. And all in all, a global exchange between utilities and wastewater monitoring experts and researchers was considered very important, especially since the topic was quickly evolving at that time. So at that point, we encouraged sharing data, sharing good practices in general in order to scale up wastewater monitoring. And we are happy to share the outcome brief of that session with you in the chat so you can refer to it. So of course, these takeaways from last year are what bring us here today. We would like to pick up where we left off and continue the global exchange that we started last year. And to help us, we have a very special agenda with some fine speakers and our moderator, Valeria, to guide us through it. So let me introduce our moderator, Valeria, to you. Valeria Suarez oversees the Secretariat for Water Operators Partnerships, or WOPs, in the Latin American and Caribbean region, also known as WOP-LAC, at Agua y Saneamientos Argentinos in Argentina. She has been working together with the Inter-American Development Bank and GWOPA in the promotion of WOPs and the coordination of knowledge activities between Latin American water and sanitation utilities since 2016. So previously, Valeria worked as a consultant for the IDB's Emerging and Sustainable Cities initiative in Argentina after 13 years with Buenos Aires Water and Sanitation Company. So a special thank you to Valeria for moderating today's session, and the floor is yours, Valeria. Take it away. Thank you very much.
Thank you very much, Hannah. Thank you. Good morning, good afternoon, good evening. Our first speaker of today is Dr. Graham Alabaster. Graham is a public health engineer by profession and is UN Habitat's head of office in Geneva. Over the years, he has looked after many different portfolios in UN Habitat, including slum upgrading, environmental infrastructure, health and environment, solid waste management and recycling. During this period, he has been on secondment to both World Health Organization and UNHCR, where he has applied his expertise to preventative health in urban settings and humanitarian environments. He led the development of the UN system-wide monitoring mechanism for SDG 6 on water. He is currently the co-chair of the RBM and Malaria Now multi-sector working group. Graham will give an input on assessing the risks of pathogens at the urban level, the many variables to consider, and some promising opportunities. Graham, please, the floor is yours.
Thank you very much indeed, Valeria, and thank you very much, Hannah, for those also introduction. Delighted to be with you all this afternoon. I'm just going to give a sort of brief overview on what I see as some of the key important issues related to this wastewater-based epidemiology. If I could have the first slide, please. Now, it's absolutely not new that we've always looked at waste as a way of understanding disease. And I mean, very early on, diseases such as polio, typhoid, cholera, methods were developed to track these diseases. And of course, the idea of using indicator bacteria as fecal coliforms and E. coli as a fecal indicator bacteria has been around for a very long time. And of course, many of you are very familiar with those ideas. But of course, the threat from disease and wastewater and sanitation-based disease is forever increasing. And if you look at the sort of risks at the urban level from diseases, you know, there was this slide I'm sharing at the moment looks at some different types of organizations who made risk assessments of diseases, many of them water-based, back in just a few years ago. And you can see that they came up with broadly the same ideas. And many of these diseases, you can see things like Ebola and hemorrhagic fever and other things. You know, we've heard of terrible experiences in many parts of the world. And of course, with the more recent COVID pandemic, we all know how important these ideas about assessing the risk really are. So this idea of monitoring was picked up quite early on in the COVID pandemic, that we could probably use this. And there's been a lot of work done in the interim past couple of years to advance the state of knowledge. Could we have the next slide, please? So really, what are some of the important key issues that we need to look at as a background to this work? You know, by now there's a very, very large number of people who have caught this terrible coronavirus. And, you know, there's over 129 million confirmed cases, and it's increasing, of course, daily. We're still not through this terrible epidemic. And many, many water authorities and health authorities picked up quite early on that we could look at wastewater-based tracking of this COVID-19. And actually, the most recent work has been actually looking at the different variants that are coming out and using this information together with other case data from medical records to understand a little bit more what's going on. Now, of course, one of the reasons why this method is so attractive is that the traditional methods which we've relied on for monitoring the pandemic during the initial period was that there's a huge lag time between actually the onset of symptoms and the results coming out of testing. And there are many, many factors that have governed that testing. And of course, not only the testing capacity of countries, but also the various methods that are available, and also behavioural aspects of people and whether they've actually gone to seek treatment or whether they've, isolated and sat it out. And of course, even the speed of reporting has been varied in different places around the world. But, wastewater-based epidemiology is actually very useful because it can provide a very unbiased sample of a community by aggregating that health information in quite an effective way. But of course, wastewater in itself and sanitation for the non-reticulated areas has a huge variation in flow and the strength and the composition of fecal matter. And indeed, in many urban areas, sewers receive not just domestic wastewater, but of course wastewater from industry, and in combined sewer situations, of course, runoff and rainwater. So there's a whole load of factors that affect this analysis, and one of the biggest challenges has been actually quantifying the contributory population to the samples that you've taken in the wastewater. But of course, the other big issue is the fact that, of course, most people in the world don't enjoy access to a reticulated sewer system, and ways to capture and monitor on-site sanitation systems are, of course, one of the biggest challenges and one of the key research areas that we need to focus on in the coming few months. But of course, the time lag in that and the sampling and monitoring and getting the results also makes this very difficult if we want to use it as an early warning system. So in fact, there's many variables to consider if we're going to make this a useful tool. And if we look here, I like this particular diagram because it actually shows you sort of in a time series analysis of how long it takes. And you can see, obviously if an individual seeks treatment, that can take time, and the results of diagnostic tests take some period. We also, need to know more about when the shedding of the virus happens into wastewater, which stage in the illness. There was some very interesting work done by some researchers who looked at not only just looking at the concentrations of the RNA fragments in wastewater, but also in sewage sludges. So, there was a lot of work done to develop a test on that, but that also provided a very good way of sampling and concentrating, if you like, the fragments of the virus. But of course, there was also a huge delay associated with analysing those tests and everything else. So really, the idea is that if we can perfect the wastewater monitoring effectively, we can get a very good lead and a good advance notice of where the hotspots, if you like, of the pandemic and the disease are showing. So there is potentially a huge opportunity to make a sort of, a huge advance and to reduce the lag time by about 7 days. Can we have the next slide, please? So where are the promising opportunities in this challenge of wastewater-based epidemiology? My first point there is about the fact that a lot of data is available at the local level, and many of you who are in water and sanitation utilities will be very much aware that you have data available. It may be in a raw form, but you have a lot of data in your databases on water production, wastewater. In many cases, the volume is monitored. But many of you have, and I know from interactions with many of you, that the biggest challenge is analysing that data and using it and normalising it. There are, of course, ways. I mentioned earlier that the biggest challenge is that we don't know what goes into sewers, but there are ways to normalise the results, and there's been some very interesting work done to normalise the amounts of fragments of coronavirus using human-specific fecal viruses that can be quantified along with measuring SARS-CoV to normalise the results. So effectively, there are clever ways to actually remove any errors associated with dilution and other factors. Now, there's also been a lot of work. I mentioned earlier about the measurement in primary sludge, but of course, many of you who work particularly on the on-site sanitation area will know that there are many stages in the sanitation chain where we need to look closely at how the fecal sludges, etc., are transported. And this, understanding that, unpacking that, there's been a lot of work done on the best ways of doing that, how it's done, technologies to do it. but it would also be good to understand better and use that knowledge to choose particular sampling points. There's been also some quite interesting, if you like, innovations in using passive sampling techniques, and there are research groups who've been using adsorbent materials such as gauze placed in wastewater channels and sewers, the idea of concentrating and picking up various virus fragments. So that, you know, there's quite a lot of work going on, and in fact over the past 2 years there's been a huge amount happening. There are also some new and novel approaches to sampling, and I've also read about researchers who've been testing the wastewater and sewage on commercial aircraft to see whether incoming flights have infected passengers. And there are some countries where scientists have been looking at monitoring wastewater from apartment buildings to you know, find undetected infections. Could we have the next slide, please? So basically, where are we? We need to move forward. What are my sort of takeaway messages from this work? One of the great things about this wastewater-based epidemiology is it is anonymous, and its ability to capture data from a wide cross-section of the population is very good. But of course, you know, that can be applied to large populations, and indeed some researchers have found that, you know, up to sort of 1 million people could be effectively measured in a single day. But there is also, of course, a sort of rather darker side to this monitoring, in that it can be used to track other substances in wastewater, drug residues, and other hormones and other things, and could, if not used carefully and ethically, cause stigmatization in certain communities. So, you know, we do have to be careful, especially if this tool is going to be used to guide and help decision making for things like lockdowns in certain communities. So we need to actually approach this from a very sort of ethical point of view to understand what's happening. We need to really assess the level of risk at urban area using as much of the existing information and capacity available at city level. And one of the, if you like, one of the important messages that's come from the COVID and the management of COVID, not just the wastewater, is that there's been this huge opportunity for particularly urban, regional, local authority-led initiatives to manage COVID more effectively. And we've seen many cases of local authorities developing new and good methods, and actually those not always being utilised or recognised at national level. So there's a lot really to understand around this area. So better mapping of these critical diseases, including COVID-19, is very important. We hope in the longer term that wastewater-based epidemiology can be used more effectively. But the other important part is we need to link this information to the environmental and social determinants at the city level, which is obviously needed, because it's fine to be able to detect the wastewater, in the wastewater, these fragments of RNA or other diseases, but we really must understand better the contribution that poor living environment and other social behaviours at city level is better understood. But I think that there is, if we look to the future, you know, one of the positive outcomes, if you like, of this pandemic is that we can, through specific techniques, normalise these parameters in wastewater, and, you know, whether it's for future pandemics, of which you've talked about the risk earlier, or whether it's to track other health indicators, there definitely is going to be an uptake of this method in the future. So I will stop there, and thank you very much for your attention. I'm looking forward to listening to the rest of the webinar. Thank you very much.
Thank you so much, Graham, for this introduction to the topic of today. Questions to Graham can be put in the chat box and will be answered at the end of the panel. Thank you. Next, we will hear from Dr. Sudhir Pillay from the Water Research Commission in South Africa. At WRC, Sudhir is responsible for the strategic molding of the non-sewered sanitation RDI portfolio that has produced novel toilet systems, a scientific understanding of the thermodynamics associated with the drying of fecal sludge, and physical and biological-based recovery treatment options for fecal sludges. He is currently a member of the National Sanitation Task Team, served on scientific committees for the IWA Peri-Urban Conference 2017 and IWA International Resource Recovery Conference 2017, related to waterborne pathogens, wastewater recycling, and cyanobacteria. Dan is project manager of the Collaboration for Sewage Surveillance for SARS-CoV-2 for Water Research Australia. Oh, sorry, I'm sorry. Sorry, I messed up, sorry. Sadir has represented South Africa for ISO standard development for non-sewer sanitation and part of IWA COVID-19 task force. Sadir will present us from their national wastewater-based epidemiology surveillance initiative in South Africa, including very recent research results. Please, Sadir, the floor is yours. Thank you.
Okay, thank you. Hi, everyone. So my presentation today is how do we link up our research activities to develop this wastewater, water quality-based epidemiology surveillance. And so we're going to show you what we've been doing in South Africa. I work as part of a team. We all handle different aspects as a team. I'm more into the non-sewer aspects, but I do have parts from the sewer domain here.
Sadir, sorry to interrupt. Sorry, could you please
Yes.
enter presentation mode? We see your taskbar.
It is on presentation mode.
Okay, we can still see your notes, and the slides are quite small.
Oh, okay, that's strange.
You want to try? Yeah, try that.
Is that better?
Yes, excellent. Thank you. Sorry
Okay.
about that.
No, it's fine. I had a dual screen open. Yeah, so wastewater-based epidemiology, what can wastewater reveal? As our speaker before, Graham, mentioned, illicit drug use, pharmaceuticals, diet choices, genetic markers, biomarkers. It just gives you a health of your community, which is being served, and where this wastewater or water is originating from. Some of the uses, general pathogen circulation within populations, characterizing change or number of infections in communities. These are all important health markers, providing a full spectrum of genetic diversity of pathogenic strains. Now, this is the reason why we are attending this particular sessions, to understand more on how we can use this tool for public health. We have been doing this, and many of the public health engineers have been doing this already. But where we see SARS-CoV-2 come is that it's actually, in this challenge, is actually giving us a basis to include a lot of these other aspects, which we've been trying to push into for a long time as part of a national system. So assess the prevalence of pathogenic bacteria and viruses and protozoan parasites, also in our water sources, to make recommendations to relevant policymakers how to improve the water quality. We've been doing this, monitoring substance abuse also through the wastewater streams. And so we're going to go into the SARS-CoV-2 bit and how we integrate this part and what we're trying to do to get this taken up as part of a national system. And so our approach is three-pronged. We have a research and development phase. We actually started off with a pilot to see first if it can be done. Once we reached a certain stage, then we decided, okay, we will go into an extended program. This is all complemented by COVID water communications, and how we try and get this integrated into a national wastewater surveillance system. And these are program outputs and outcomes and impact that we're looking for. So outputs, we're looking for interlab proficiency, for labs to work together, to correlate, to have some of the methodology integration of data. The outcomes is your heat maps, your relationships, your strategic partnerships. And what we're looking for is the impact. Can we get an early warning system and a model for general national water quality surveillance? As I said before, we have different phases. We finished the proof of concept that was done successfully. We've passed into phase 2, and we in between phase 2 and 3 at the moment. Important part, like most developing countries, we're not fully sewered. Actually, there's very few municipalities in South Africa that are fully sewered, and so there's a significant population, a vulnerable population that's not covered by sewers. This is actually an aerial photograph in South Africa and shows the difference. It's not two separate pictures, it's one picture. On your left is the more affluent area. On your right is a more high density area where social distancing and those type of restriction measures are difficult to do in such an area, especially when you have shared toilets, shared taps. And how do we include this as part of a city-wide surveillance? So this is just going through some of our proof of concept. We started off with 24 sites. We looked at the wastewater plants and also looked at the runoff. So runoff in informal areas. This is all released. It's all available on our website, but the listed bullets give you a breakdown of what we found. We found 98% of our samples tested positive for the RNA. Proven a complementary surveillance tool. It was cost-effective, less invasive screening procedure. And we also looked into the methodologies, which ones are the best methodologies, and we found the skim milk one really worked well for us. From this pilot and proof of concept study, it's available on our website. You can have a look at it. We moved into the phase 2 aspects. I'm just going into some of the non-sewered part. We did a few random samples and we did detect in surface waters. We're looking at volumes, and we're actually looking at extending this program as part of phase 2. So we're having more sites and also developing the framework for non-sewered. We know non-sewered applies to a lot of things. Do you measure individual toilets, a septic tank, or a pit latrine? Or do you measure the runoff from a communal tap or from a communal toilet? So it's having a look at the costing for this, the ease of doing this compared to clinical testing. And so we're on our way with this. I think Graham mentioned that there are a lot of swabs and different type of sample. We actually borrowed this idea from Australia, where they have this passive river sampling tool, and we've been using it with swabs to collect farm runoffs in these informal communities, and we've been testing it. We're looking around the country and doing this, and now we're actually looking into different variants, so variants of concern or variants of interest that we're getting from these type of samples. As I said, a lot of these are out and available. The ones on the left is from the Water Research Commission. The one on the right is from our Medical Research Commission. And we need this data and the different treatment plants and how we pull this data together. So the first part was just a simple Excel spreadsheet, but we want to pull all this data up into a national system. As I said, we're scaling up to 50 plants, network of labs, training materials, development of inter-lab comparison, including the non-sewered aspects. And there's more research, so looking at new sampling methodologies, new testing tools like digital drop, always improving the sensitivities of the analysis. As I said, we look at multi-lab analysis for the second phase, and we have different lab systems available, and they have their own methodologies, but it's very important to have all this collated so the results can be compared between the different laboratories. As I said, the surveillance dashboard, we're starting with this, and we're working with our National Institute for Communicable Diseases with this. This is some results of our COVID situation in the country. So it's given you by provinces. We have provinces in South Africa. We're actually in the third wave. So on your far right, it's a bit of the different scenario because the wave is not dropping. The peak, we passed the peak, but it's still not dropping. It's driven largely by the Delta variant. As you know, many of you know, the Beta was detected first in South Africa. We've been looking at some of our wastewater plants, and this correlates to the third wave, and you can see the data is more or less correlating to what we've seen from clinical samples. We're looking at variants of concern or variants of interest. I think the important thing is we've seen a movement from the Beta strain to the Delta strain quite quickly in South Africa. I think you find that in many other countries. But the important thing is that when we're monitoring the sewage, we found a large percentage of gamma also. And very importantly, this was not detected in any of our clinical samples. So this is an importance of having this wastewater-based epidemiology. You can pick up things that not necessarily showing up in your clinical specimens. This is some examples from our Medical Research Council and how they've been sampling the different areas and then the different types of hot maps they're producing. And the different colors that will give you an idea of viral RNA copies, and the darker it is, the more viral roles are being detected. As you can see, it's just an example of the type of heat maps we want to produce. And just to close on, the research still goes on. We're looking at different aspects, looking at aerolization, looking at occupational health risks, and always tracking the evolution of the virus. There's further studies that are going, and as I said, we're always trying to refine the sensitivity of the different methods as we're going along. So I am done. Thank you very much.
Thank you very much, Sadir, for this insightful research. Questions to Sadir and research of WRC can be put in the chat box too and will be answered at the end of the webinar. Next, I am pleased to introduce our first panelist from Water and Sanitation Operators. This is Ana Paula Comino from Obras Sanitarias Mar del Plata in Mar del Plata, Argentina. Ana Paula is the Deputy Quality Manager. OSSE is a state company of the municipal government. Luckily, to date, there is a sustained drop in cases of COVID-19 infections throughout the country in Argentina. She will tell us how OSSE learned about techniques for wastewater monitoring and is now contributing to the surveillance of COVID-19. Ana Paula, tenés la palabra. Gracias.
Buenos días.
Good day, good afternoon for some of you, or good evening, depending on where you are. Thank you so much for your attention. The idea is to share with you how we've been building this story, where we're coming from and where we are at in our endeavors. Back in March in 2020, we found out through some work published in the Netherlands that there was a study whose main author was Ana Maria da Rodas Hoekman, about the analysis of wastewaters in airport effluent areas. And in that publication, in that paper, we read that the waste in those effluents could be explained by the shedding of viruses of individuals who might be symptomatic or asymptomatic that had gone through the airport. And so wastewaters could be used, therefore, as a way to survey and provide early warning to avoid the dissemination of the virus in a particular area. And so we got in touch with the reference people. They shared that they were trying to put together a national surveillance network, which we found very interesting. We got in touch with the National Epidemiology Institute, who luckily has headquarters in our city, and that facilitated our joint work. And because the Biology Institute hangs from the Health Ministry. Parallel to that, we also got in touch a researcher from the National Scientific and Technical Research, COMISEC, researcher got in touch with the Institute because she had received a grant to work on this topic with the same view. So we started joining forces and working together to first test the waters, obviously, and know what was happening, learn about the current situation. During that time, WOP-LAC invited us to work on the Action Platform Network sessions, webinars we attended, and also we joined the utilities municipalities WhatsApp group, where we share knowledge and experiences on this topic. Paper publications and so on. This is a group with colleagues from different countries, up to 60 countries. This was such a useful group, really important for our work. because it provided inspiration to see what was happening in other parts of the world and to be in touch with the international community working on the same topic. We also got in touch with the people, the colleagues who are friends by now from Agua de Saneamiento Argentina, the Argentinian sanitization agency. We have a historical relation with them. They are a reference, really. And they were in touch with an operator's company from Murcia, developing an effluent concentration technique by way of centrifugation. We saw that was feasible, that we could do that at our lab, because up until then we had not worked on that topic. So we had to consider with the tools we had what could be done to start as soon as possible surveilling. And so we developed this concentration by centrifugation technique, the same used by ISA and used by these operators from Murcia. And the second part of the analysis, which is the PCR analysis, we continued in the National Epidemiology Institute. We took the samples, concentrated them in our lab, and then take them on the same day to the National Institute of Epidemiology, which is close by, and they would continue processing it to get the test results in the day. In Mar del Plata, considering we have 95% of the population covered with sewage, we took samples in one specific point, which is the input point at the treatment plant. We're taking representative samples of the population of the city that way. But to avoid interference that may be due to the industrial contribution to effluents, we took samples on a Sunday always. We consider that on Sunday there is more local effluent in the urban effluent, and we avoid interferences due to the industry effluent component. We also optimize the technique given the interference of a matrix or the uncertainty such as this variable that entails a variable such as this one, the sewage effluents. What we did was take samples sixfold to improve the results and the technique. And the results we obtained weekly, because every Sunday we would take a sample and undertake this process. Those results were shared with the corporate authorities, and we also perform a joint periodical evaluation and provide a report for the authorities of the three participating institutions, the president of Mar del Plata Obras Sanitarias, the service provider, the National Institute authorities, hanging from the Ministry of Health, and also the authorities, the Scientific and Technical Commission. And so all in all, the way we contribute as operators to the surveillance of COVID-19 is threefold. First, we provide information in real time with the results of that we take each Sunday to the institutions. Then we produce technical and scientific regular reports that we pass on to the authorities of the three institutions. And we also do scientific communication and publication in congresses, in specific journals, which is something that's underway. This is what we are working on now, producing papers at this moment. And what I would like to share also is that this space provided by WOP-LAC, I think, is very important to share the vision as to how we approach these studies for COVID-19 and also in the future to promote the use of epidemiology and water-based epidemiology, to be more specific. As for the sampling methods, we are taking samples in 24-hour rounds because of the nature of the network, but we can also do specific sampling at a particular given time. that's possible in certain register areas. And it's an experience worth considering to have an idea of the hours when there is greater fecal sludge effluence in the urban network. We're not doing studies by basin yet, but that's also a possibility. In the case of the 24-hour sampling, there is automatic tracking. And in any case, it is very important to understand that the analysis needs to happen soon after the sample taken. So we do this in the same day to get the results on the same day or latest the next morning. So I want to clarify, having said this, that it's very important that operators take part in all this and help us. Because it's us, operators, who know the matrix, the effluence matrix, to work with it in the lab. It is a heterogeneous, complicated matrix. And so the knowledge that the service companies have is very important, is of the essence. Further to that, we also know that a sewerage network and how it operates. So I consider this is a fundamental pillar, the presence of operators such as us in this type of study. Now, the way we can ensure an open experience and open collaboration is to establish a clear guidelines among the different parties agreeing on the research goals, which should be the wastewater-based epidemiology study, without tampering with the nature of the samples. And the information resulting from this surveillance is something that needs to be provided to the health authorities. That's a competence that lies with them. So we cannot really move forward if these authorities do not join forces. Without their participation, we cannot do anything. And without the cooperation of operators, we cannot do anything either. So we are working all together up until now, and we are getting really good results by way of that cooperation. Thank you very much for your time. That's all from me. Thank you, Ana Paula.
More in the discussion round later. Next up will be Mark van Bemmel, CEO of Orvion, a private company in the Netherlands, and Marc Dubois, CEO of Upande, a private company in Nairobi, Kenya. They have jointly developed Upande and Detect software for analyzing data of COVID-19 virus particles in wastewater. They have performed a first monitoring campaign in Kisumu and Nakuru cities in Kenya, together with the utilities Nawasco and Kiwassco. Please, Mark and Mark, the floor is yours. Thank you.
Good morning, good afternoon, good evening to all of you. Thank you very much for this opportunity. I understand Francisca is sharing our slides. Could you go back one slide? Okay. So we will be presenting on a project that we've been carrying out together called MOCOMO. MOCOMO stands for Mobile COVID-19 Monitoring in Sewage for Strong Cities and Regions. And this is a pilot project that we have been embarking upon this year with the support of Aqua for All and UN Habitat. It is a partnership where Orvion, a company based in the Netherlands, has partnered with us, a company in Kenya, a software company, to come up with innovative solutions that can detect COVID in wastewater within a few hours. We will be sharing our results and our work and next steps in the next few slides together, and I'll now hand over to Mark.
Yes, next slide, please, Francisca. I'm Mark van Bemmel. I'm a CEO of Orvion, and we are an environmental biotechnology company in the Netherlands. And we focus on DNA and RNA techniques for water quality control. And yeah, you can move on to the next slide, which is probably a bit more important. We would like to present results that we have gathered on COVID monitoring with using UDetect. UDetect is a rapid system for mobile PCR analysis. It was developed for bacterial analysis in water, and for the project in Kenya, we changed the extraction method to be able to analyze RNA from COVID. So we did a lot of work for this project to make it work, to analyze COVID in wastewater. The method is based on the filtration step and DNA and/or RNA isolation step, and then followed by a qPCR analysis. And it can be used by operators or water sampling after a short training, so you can learn how to use it in a few hours. We give this training online. And then you are able to use UDetect in the fields. Very important aspect is that all the reagents that are used for the PCR or the RT-PCR step in the thermocycler are lyophilized and can be stored outside of the fridge. So you don't need any kind of cold chain to be able to perform this analysis in the field very fast. Next slide, please, Francisca.
So Upande, the company that I founded, has been around since 2009. And it's basically a software company. We focus on innovative, transformative solutions in water management. And I've actually done a lot of work also with GWOPA and UN Habitat. Also, we worked a lot with Graham Alabaster in Kenya, developing applications to disseminate data and promote data-driven decisions. As a company, we do a lot of work for utilities, offering software as a service, but also sensor as a service. And through this partnership with Aqua for All and UN Habitat, we've added a software module for UDetect integration, where the results from the PCR technology and the UDetect system of Orvion can be fast entered from the field onto a software platform. Next slide. That entails also visualizing the data where sampling has taken place by integrating it now with a GIS system, where an overlay of the sewage locations, the sewage infrastructure can be linked to also the sampling sites, including also the result of dissemination. So this is an application that is still being built, but we have been actively carrying out some of the sampling work, as we'll cover in subsequent slides. Next.
Yes, as I already told, UDetect consists of 3 steps. First, you filter your sample. Then you do the DNA and/or RNA isolation. So for COVID, it was an RNA isolation, obviously. And then you can run your sample in the mobile qPCR device. And the entire system is without electricity, except for the last step, the thermocycler, which can be run on a car battery or on the net. And there are all kinds of applications. I just mentioned 3 below. You can, for instance, on-site detect cyanobacteria genes in drinking water distribution. Another idea is to have an early warning system for fecal contamination, for water reuse purposes. And obviously, we are talking about today the COVID-19 monitoring in sewage. Next slide, please. At this moment, we have several targets available that you can monitor in your wastewater or in your other water streams, which are fecal contaminators like Escherichia coli, Bacteroides dorei, also Legionella and Salmonella, cyanobacteria toxin, and other pathogenic organisms. And for the wastewater, we have the SARS-CoV-2 E gene and N2 gene. And we're working on several other targets and kits that we are adding to the pipeline for UDetect every time. Please go to the next slide. So the MOCOMO project was focused on making the UDetect pipeline for bacterial analysis in wastewater available for sewage monitoring of COVID. And we worked very hard to adapt our DNA extraction method towards RNA extraction. We had to change the entire way of filtering. The sewage is obviously a very dirty and difficult matrix. So we've been working on that quite a lot. We detected the E gene and the N2 gene in this method. We also in our method we use several controls, and we will show the results of those controls. One control is Bacteroides, which is a human fecal indicator organism, which is present a lot in wastewater. And another control is an inactivated virus that we also use to check if the entire RNA extraction was performed well. So if we can trust the results on the COVID. We worked on this project in June, July, and August of this year. So yeah, we've just done the sampling and the analysis of the first round. We thank UN Habitat and Aqua for All for the opportunity to do this. And also the cost of UDetect are quite interesting because of the low capital and operating costs. Next slide, please. Maybe Mark, you can do this.
Yes. So as mentioned also on the last slide, we have been piloting this project with Orvion, with the stakeholders in Kenya on the ground. That's both in Nakuru, so Nakuru Urban Water Sanitation Company, as well as Kisumu Water Sanitation Company. We're also present on the call. And we were carrying out a total of 60 samples as part of this project. And together with the stakeholders, identified what are the key locations where we might be able to detect COVID as much as possible. So we, together with the stakeholders, identified particularly health clinics and hospitals as the first locations to try out the samples, where we would expect a higher results. We also carried out samples at the sewage treatment works in both Kisumu and in Nakuru. And the beauty of the system is that within 2 hours, without using power or using power from a car battery, one is able to complete the cycle and be able to get results. You can see the staff from Kisumu in the bottom right carrying out the samples in an outdoor lab. So in that sense, no equipment is needed. Next slide.
Yes, I would like to point out some results that we have. We have analyzed 60 samples, of which 45 are used for analyzing in the field and 15 for training. In 7 samples, we didn't find our RNA extraction control. So in 38 samples, the RNA extraction control was okay, with a 48% good recovery of the RNA control. In most of the samples, we also found a lot of Bacteroides, so 40 from 45, 89% in very low CQ, so very high numbers of Bacteroides RNA found. We found in 5 of the 38 positive REC samples, we found the N2 gene in the CQs that are mentioned in the table. Which is maybe rather low. We don't know exactly. We didn't find the E gene at all in any of the samples. And the next slide, I elaborate a little bit more on what can be the origins of that. Oh, there's another slide. So, sorry, Mark, it's yours.
Yeah, before we get to the way forward, as mentioned, there is software that we've been developing that allows the utilities and future users of the system that we're looking to engage with in a second phase of the project to be able to do these analyses themselves and upload the results to a web-based platform that we've been developing, where the GIS location of the samples can be overlaid and integrated with the GIS data in a very user-friendly, lightweight framework that we're calling now the Upande UDetect module. Next slide.
Okay, so the lessons so far, I would like to summarize them. The method works relatively well in Kenya. We didn't have any major problems. One big thing was that the volume filtrated that we could filtrate from the sewage in Kenya was lower than we had than we did in the Netherlands, which could have been expected maybe because of less dilution of the sewage. So it was more difficult to treat. We have to stop now, I think, but I'll wrap it up very quickly. We didn't find the E gene, probably because of mutations in the meantime. We have based our E gene primers on the first publications, so maybe this is the cause of that. We found relatively few positives, but it could be that there was not that much illness in the period that we have sampled. We did get the results fast, within about 2 hours, and actually we would like to obtain more results and update the primers for the latest variants. That is the end. Maybe the last slide. Thank you all very much, and looking forward to your questions.
Thank you so much, Mark and Mark. Questions for Mark van Bemmel and Mark Dubois can be put in the chat box and will be answered at the end of this webinar. And now we'll hear from our last panelists from Australia, Dr. Daniel Deere and Dr. Paul Moniz. Paul Moniz is Manager, Research, Stakeholders and Planning at South Australia Water in Adelaide. He's a molecular microbiologist with the Australian Water Quality Centre and in-depth subject area specialist on issues of high importance to water utilities. He and his team have conducted extensive research and innovation related to waterborne pathogens, wastewater recycling, and cyanobacteria. Dan is project manager of the Collaboration for Sewage Surveillance for SARS-CoV-2 for Water Research Australia, a not-for-profit research management organization. In Australia, COVID-19 is in its second major national wave due to the Delta strain. Among others, Dan and Paul will tell us about a multidiscipline international knowledge exchange on SARS-CoV-2 monitoring. Dan, Paul, please. Thank you.
Thank you. So we will briefly cover this. I will give some brief summary of the program, and Paul will give some more technical detail on the technologies being used. So on the next slide, I'll just show you a summary of historically until the last month, the main use case in Australia and New Zealand has been for low prevalence use case. So the purpose has been to test the wastewater in small quantities, in small catchments, to try to get early warning of cases in those catchments. So the Water Authority has been working out which sewage treatment plants and which sewer access points and which buildings are the best places to test. And the sewage has been collected from those places by the water utility. And the health department then takes the results from the water utility lab and interprets those along with the other data they have from the clinical testing of humans. And this is an example from the New South Wales government weekly reports. just showing the green dots show no presence. The red boxes show the presence of SARS-CoV-2. And this is used to help guide where the health departments send their tracing and testing programs and where they set up testing clinics. And it's also used to drive decisions on travel and travel between centres in Australia and New Zealand. So the next slide gives an example. So this is an example from the state of Victoria. Victoria is one of the states in Australia. It's a similar size to the UK. The capital of the state is Melbourne, the city of Melbourne in Australia. It has about 7 million people. And there are lots of small towns around the state. Many are quite isolated. And the government, the health department, has a website and they show whether they have found detections. If they found detections, they then alert the community using the newspapers and the media and the short messaging service on telephones to get tested and encourage testing in those areas. The next slide shows some examples of results. This is an example from a detection in a small town called Apollo Bay. The sewage treatment plant only has a small catchment, so the positive was evidence there was contamination. The health department urged the population to get tested. They were able to find a positive case, and they were able to isolate and trace and eliminate the COVID outbreak from that town. The next example is at a smaller scale. This is from a building scale. You'll see the tower blocks, the large high-rise tower blocks. In this case, the sewage testing of the tower block, there was testing taken from the tower block itself. Those results were used to test everybody in the tower block and find the cases to help contain the outbreak. So it's largely been used in that way. So go to the next slide. And just what we've done in this program, it's been a very strong collaboration between the sewer operators who give advice on how to safely sample from the sewers and the sewer networks, with the water utility scientists working in the laboratories and working in the sewage networks, as well as very good collaboration with the health departments and the research groups and the research scientists. So it's been a very strong multidiscipline collaboration. We've mostly used imported technologies, so the Kiogen methods have been vital for extraction, the German Kiogen kits, and also some American and other PCR reagents. But luckily Australia has enough buying power to be able to keep them coming in. We've had good supply chain. So people like Paul and Paul Monis were very organised, and Nick Crosby, who you see on the top right there, he's from Melbourne Water, to make sure we could get the supply chain set up for the equipment from those companies. And so far we've had good supply chain of those to the country. But smaller areas have had more difficulty. And so we're having more difficulty in smaller communities outside of Australia. So the next slide just shows an example. On the left-hand side, the block on the left-hand side shows the utilities. So Paul is from OSSE Water. We have many other water utilities involved, as well as many laboratories and universities, and a lot of good international collaboration with Water Research Centre in South Africa, and many other parties in Canada and the US as well. The last slide just shows current stage of the program. We're looking at developing a manual, a bit like the one that South Africa showed earlier, that shows the different practices. And as part of that, Paul Monis is currently working on a technology transfer. So the last slide lists the countries. So look to the next slide. So Paul has some funding from the Australian Aid Agency to work with Thailand, Vietnam, Laos, Cambodia, and possibly Myanmar and Fiji to help them set up similar programs. But a bit like South Africa, there's a lot of areas are unsewered, which is different to Australia, and there are more difficult supply chain challenges, particularly in places like Fiji. It could take us months to get some of these reagents into those countries. So we're looking at how to adapt to that. So Paul, do you want to make any comments before we do the panel session?
Sure. Just a comment on the, so as Dan said, the monitoring here is a partnership really between the water utilities that are providing the expertise for the sample collection from our sewage systems or from our treatment plants, and also the information about population sizes and breaking networks down to a suitable size for monitoring. And then some of those utilities, ours and Sydney Water, have their own testing laboratories so we can do our own sample processing and SARS PCR testing, RT-PCR testing. There's a fairly consistent approach across the testing laboratories and the methods that are used. So for liquid samples, so composite samples, where I think all of the laboratories are using electronegative membranes to process those samples for concentration. There's a small bit of variation in if there's any pre-processing, like we use centrifugation to remove particulates, because PCR inhibition is a rather large impact on assay sensitivity. But we're all using similar like membrane filtration, or we're using the passive sampling devices that you saw on an earlier talk. So we actually 3D print our own, and they can be reused, and we found them to be very useful, much better than grab sampling. So where we don't have, so in our treatment plants, we may have composite samplers, but within networks into the sewers, we don't have mobile composite samplers, so we rely on those passive samplers, and we deploy those over 3 to 4 days. So we basically can monitor continuously with 2 samples a week across all of metropolitan Adelaide. So that's sort of like the approach we're taking. Dan mentioned the extraction process as well, and so yeah, we're using predominantly the Collagen extraction kits or the Magmax kits from Thermo. One of the critical things, though, that we found is that reagent selection for the RT-PCR steps is very important, and probably 3 of the main testing labs doing testing in Australia are using PerkinElmer SARS-CoV-2 clinical test kit, because we found that to be the most robust in the presence of PCR inhibitors. And there's other test kits we've trialed, or other even one-step PCR reagents that often struggle for the various types of wastewater sample extracts that we have. And so that's one of the critical things that we found for consistent results. I think I just heard the bell there, so I think we'll leave it at that.
I think we can finish there and go to the panel and discussion session.
Thank you. Thank you so much. Well, thank you to our panelists. We've listened to Graham Alabaster's introduction to today's topic, and we've listened after to interesting experiences from South Africa, Argentina, Kenya, and Australia. Now I will invite our panelists to answer some questions from the audience. You've been indeed very, very active on our chat box, but there are still some questions. So I have a first question to Graham. Please, could you elaborate a little more about stigmatization?
Can you hear me okay?
Yeah.
Oh, somebody, other's microphone. Yes, sorry, what was the Valeria, about the stigmatization?
Yes, because you told us about possibility of stigmatization with this method. So could you please talk a little bit?
Yes, certainly. I mean, I think really the situation with all of this, these types of analyses, is that it's very important that we understand the ethical implications of what's going on. So, I mean, we have to be very mindful of the fact that there's already a lot of social exclusion in cities and urban areas for a variety of reasons, and of course in rural communities. But we shouldn't be using these monitoring methods to cause more tension and more stigmatization when there's already some very difficult circumstances. I mean, I think one of the most important issues about this pandemic, which is not really addressed enough, in my opinion, is the huge impact that this has had on people's mental health. I know this isn't the forum to discuss this here, but we have to be very careful that what we're doing is actually contributing to improvements and it's not causing more dividing societies more and causing issues. I mean, there's lots, as many of you know, there's lots of issues around the vaccination and the mistrust of these methods, and we wouldn't want the same thing to happen if we find that this wastewater monitoring is being used by communities. So for me, it's a very important issue that we should always have this at the back of our mind, and we should see how we can present this in a positive way. Thanks very much. I think that's really what I wanted to say. Over.
Thank you, Graham. We have another question about who's financing wastewater monitoring. Some of you have already answered in the chat. Maybe Ana Paula can tell us a little more about what's happening in Mar del Plata in Argentina. Who will help with financing this monitoring and these new techniques? Ana Paula?
Well, the sampling is financed with our own resources, with the material we already had, and the concentration of the samples is financed by us. So, with our own resources. Now, the National Epidemiology Institute hangs from the Ministry of Health, so they basically use the resources that the ministry has available to it to analyze the clinical samples. They've supported, obviously, this second stage, which is the PCR analysis with the effluent samples, that the Ministry of Health, that is. And also there is the collaboration for the same project of the National Commission of Scientific and Technical Commissions with a grant they received from the Commissar to work on this.
Thank you, Ana Paula. Would you panelists have any question for each other, maybe? Do you want to raise hands? Okay. Not pretty much. Do you think that any exchange and peer-to-peer experiences between your respective countries and your respective utilities could be held in the future, you panelists? Okay, maybe Paul has a question maybe in the chat, I'm told. I can see your hands raised, sorry.
Yes, thanks.
Okay, go ahead, Paul.
I was just going to say that there was a question earlier about, I suppose, sensitivity in terms of size of population. And one thing we found with Delta in particular is that it's, I suppose, easier to in a low prevalence setting, detecting a case is a bit easier than with, say, Wuhan or other variants or other strains. And so we were detecting, say, one case in wastewater catchment of, say, 90,000 people. So the assays can be fairly sensitive, especially for some of these variants appear to be excreted at higher rates compared to other like the Wuhan strain. The other complication there was also a discussion about relating virus numbers and wastewater to case numbers. One of the complications is that people continue to excrete after their infection is cleared, so they're no longer clinically positive, but they may still be excreting. So we do find that, so in our situation, people go into hotel quarantine when they come overseas or from interstate, and positive cases go into medical hotel. But when they're released, we do get occasional low-level detections in those suburb areas where they go back into the community too. So in a low prevalence context, you may see low-level detection of virus that's not related to active infections.
Thank you, Paul. Dan, do you have a question or a remark to share with us, please?
Yes, so the question relates to the experience from South Africa in the unsewered informal areas. Most of the work we see published from the Netherlands, from Australia, from the United States, from European Union. Most of this work is great, but most of it's from sewered areas. There's not been very much work in informal areas, but we have billions of people in unsewered areas around the world. I think your group is one of the few groups that's looking actively at that. We're very interested in your experience in that.
It's part of the reason why we want to try it. South Africa is a bit of an unusual situation because we have about 70%, 65 sewered. But just like the rest of the African countries, our rate of urbanization is higher than any place that's experienced in the world before. You know, some of the predictions are quite high, and so you have these mega cities with sewered and non-sewered stuff. And so the first thing we had to do was narrow it down. What do we really need to sample? Are we going to sample a pit latrine? Are we going to sample a collection of see if you guys are in Thailand or Bangkok or let's say Vietnam. They have more pore flush style type of systems. There will be a honeysucker. Do you sample the honeysucker then as indication because it will have a root, it'll collected certain paper, maybe it has a log of waste collected, and so you need to do the business case for it, and that's what we're doing at the moment, is looking at that business case. Which framework do we look at sampling? Where do we look at sampling? We already established is no point sampling from our dry sanitation systems. It doesn't it doesn't give us same benefits for community, and also it's not going to have any benefit over individual clinical testing. So we found generally the runoff from the community, the actual grey water, was a good determinant. And we actually trying to correlate it with standard wastewater parameters, your COD and your normal fecal coliforms. We're actually finding it's like raw sewage, basically, the runoff. And we're using that at the moment. So the same 3D printed sampling devices you guys use, we've actually applied it in our setting to take samples. And we're also trying to correlate. We're finding the weather pattern does disturb it a bit, the concentration. So we find if it rains a lot, you might find a peak come through. And we're trying to narrow that down to say, how do we include this part and take into account the different variable environmental parameters also for that. But I think for you guys, because your focus is more on the Asian systems, with us, we'll have a manual collecting system for the Asian systems. There is a honeysucker process where they take it. They might dispose of it in environment, but there is it's a generally more wetter type of sludge. It might last longer. I know some of the Chinese researchers have found that, the virus load actually increases after certain hospital type of settings where they found that it disrupts, when the virus is sticking to the sludge, and then when they try and destroy it, it's more RNA is being detected. So there's a lot of variables to be testing. I think the non-sewage, because it's non-sewage, is more variable. So you have to get that framework down to narrow it to make the business case for it. I hope that makes sense.
It does, and these countries have a combination of all of those in the same country.
Yeah. So even the guys from India were asking me, what would you recommend? Something I would recommend the nalas also. The nalas are giving good indication, but they're not as strictly defined as a catchment as a sewer, because a sewer is laid down and you know the catchment and you kind of have an idea. And that's where the business case comes in. You know, do you have 10 households? Would it be worth doing a WE for 10 households, 100 households, 1,000? Sewer makes sense because you have over 100,000 people, you know, usually. So it's the scale of the testing.
Great, thank you very much.
For us, we've been finding some good stuff even with the sewer stuff. Our delta was more prominent. It overtook the beta quite quickly in a space of few months. But we've detected the gamma also, but that hasn't been detected in any of the clinical samples. So I think that was an important finding for us here. You know, with the emergence of new other variants, the Mu and Lambda and those type of things, it'd be nice to have this early warning system to say, okay, we can see a bit of a peak, because your clinical samples in South Africa only represent for the variants probably only 1% of the total testing, or 2% at most.
Thank you so much.
I'm open to discussing some of these guys with some of the results with you guys also, to choose, so you can streamline your research protocol if needs be.
Thank you, Sadir. I think Marc Deblois has his hand raised. Marc?
Yes, thank you, Valeria. I just wanted to respond also to your earlier question with regards to whether also there's, let's say, cross-exchange happening with other initiatives, maybe with other utilities. I just wanted to mention that there's also another project happening concurrently in Kenya, in Nairobi, with World WaterNet and Nairobi Water, the metropolitan government, and the ILRI. So we are also liaising with them to see how we can exchange knowledge and potentially use tools, share tools also for publishing also the data and analyzing the data. So that's something that's currently ongoing. I'd also be interested to maybe hear from Sudhir, maybe in another session, or lessons learned also in terms of linking now the results, let's say, of the analysis to do also population counts. We are doing that analysis right now using data in terms of sewage connections and population information from the utilities. But it's not entirely clear in some cases how the sewage is flowing. So it's not a very easy exercise. So lessons learned in that sense from South African context, or maybe from other places, would be quite interesting for us to hear about. Thank you.
Okay, thank you, Marc. And while we have our last question, Ana Paula, you have a question?
No escuché la pregunta.
I didn't hear the question.
Raised or not, maybe?
Okay. Porque...
All right, yeah. I just wanted to thank everybody for this space, because I want to underscore how important it is to exchange knowledge. This is a complex issue. It calls for different levels and kinds of expert knowledge. Even each region has its own particularities and particular traits. It's not a straightforward issue, and I think it is of the essence that we share experiences and we are interconnected. The whole international community should be connected and join forces. So I think I'm thankful for this space and would love for it to continue. Thank you.
Paula? Okay, I will thank now all our panelists. I'm sorry for my technical issues. I've been out for a little seconds. And I would like to hand over now to Francisca Volk from the GWOPA Secretariat for letting us know.
Hello, I think, at least from my side, I lost Valeria.
Yes, we've lost Valeria.
It was a shortened introduction, that's fine. Thanks everyone, all the speakers. It was really interesting, inspiring. I feel I've learned a lot. Thanks to the many participants here. My name is Francisca Volk. I'm with the GWOPA Secretariat based at UN Habitat. And as also Anna just stressed, it's super important for all of us to share the knowledge, to have peer colleagues to reach out to and to ask these questions, to get them answered. So I want to present to you and invite you to 2 more platforms and options where we can continue the discussion in the upcoming weeks and months. The first option and platform for collaboration is the GWOPA online community of practitioners. So this year, GWOPA launched a collaborative platform hosted on Workplace. On this platform, you can create your own profile, you can follow people, connect to peers, you can ask questions, share researches, share invitations to events. If you have agreed to it in the registration, you will receive within the next 24 hours a kind of exclusive invitation. And by that invitation, you can just join and connect to the platform. And also the follow-up discussions of the webinar, all the unanswered questions will go on this platform, and we'll try to find the answers there. The second platform where we can exchange on many, many topics beyond wastewater-based epidemiology is our upcoming 4th Global WOPs Congress, which will take place from the 18th to the 29th of October. It will be an online event. It is free of charge. The registration is open, and you will in a minute see the link to it in the chat. There will be really exciting sessions, 5 tracks on 5 thematic tracks, 4 different WOP tracks dedicated to water operator partnerships. There will be regional events, side events, operator stages, and many more. So it will be an inspiring 2 weeks. Please join us and do not miss it. And last but not least, we have prepared a mini farewell poll on our favorite platform, Mentimeter, because we wanted to put 2 questions to you out there, because we know you have extensive resources, extensive knowledge to share, but you also might have some questions for your colleagues. So the 2 questions you'll find on this poll, and we'll leave it out for the next couple of hours, is first, if you have any project results, any research resources on wastewater-based epidemiology that you want to share, please put them there, maybe the link or the name of it, and we'll include it in the webinar outcome report to have a bit of a resource collection there. Second question is, if you have any questions to your peer water and sanitation operators, please put them also there. We'll try in the next couple of weeks to get those answered for you, because in the webinar we have only so much time, 90 minutes. We still learned a lot, but of course some questions remain there. So please go to mentimeter.com. My colleague Florencia will put the direct link also in the chat for you. And with that, again, a big thank you to everyone involved and everyone who supported the realization of this webinar, especially to our co-host GIZ and Hannah in the lead there. Thanks so much. I'm very much looking forward to the next webinar taking place in December. And before that, of course, the Global WOPs Congress, where I hope to see many of you again. With that, I say bye and a good evening, day work of day, good night, good morning, wherever you are. And thanks. Hope to see you soon. Bye.